Hello everyone, welcome back to my channel Dr.shil's Physio. Today we will discuss the second part of the SVNIRTAR MPT exam 2025 questions. Let's start. Today's first question is impairment not present in a child with Duchenne's muscular dystrophy is option A Marian sign, option B Gower sign, option C Carning sign and option D pseudohypertrophy. Here the correct answer is option C Carning sign, Marian sign, Gower sign and pseudohypertrophy are present in the Duchenne's muscular dystrophy. Duchenne's muscular dystrophy is a X-linked recessive genetic disorder caused by the absence of dystrophin leading to progressive muscular degeneration. Carning sign basically seen in meningitis due to meningeal irritation. Next question number 27. As per ICF classification, inability to flex elbow is option A an impairment of body structure, option B an impairment of body function, option C functional limitation and option D participation restriction. Here an impairment of body function, a body structure is basically leads to loss of bone or joint. An impairment of body function is loss of physiological function like muscle contraction. So here flexion of elbow is a muscle contraction. The correct answer is option B. Functional limitation is basically activity limitation, or difficulty in performing task. Participation restriction is difficulty in social involvement. Social or societal involvement. Next question number 28. Therapeutic effect of Kinesio taping is because of its effect on option A skin, option B fascia, option C lymphatic and circulatory system, option D all of the above. Here the correct answer is option D all of the above. Kinesio taping is developed by Dr. Kenzo Case. Skin basically work as a mechanoreceptor stimulation and helps in pain reduction. Fascia improve movement and reduce tightness, and lymphatics improve microcirculation and reduce edema. Next question number 29. Therapeutic effect of cryotherapy in pain relief is because of option A muscle fiber activation, option B reduction in conduction velocity of nerve fibers, option C increase sensitivity of the nerve fiber, and option D reduce blood supply. Here the correct answer is option B reduction in conduction velocity of the nerve fiber. Cold shows transmission through A delta and C fibers. So reduces pain perception. Next question. In phase 3, what parameter is used for exercise prescription based on stress test result? Option A, resting heart rate. Option B, blood pressure change. Option C, 6-minute walk test. And option D, maximum heart rate. Here, resting heart rate is a baseline assessment tool, not a exercise prescription tool. Blood pressure is a vitals measurement. 6-minute walk test used for functional capacity test. So maximum heart rate is basically used for exercise prescription. 60 to 80% of maximum heart rate, or you can use Carbonell's formula. Next question. Question number 31. A positive Trendelenburg sign does not occur with option A, coxa vara, option B, paralysis of hip adductors, option C, excision arthroplasty, and option D, congenital hip dislocation. Here the correct answer is option B, paralysis of hip adductor. Trendelenburg sign occurs when hip abductors, mainly gluteus medius and minimus, fails to stabilize the pelvis during single leg standing. The pelvis drops on the opposite side. Coxa vara causes positive Trendelenburg because it decreases the mechanical advantage of hip abductors. Excision arthroplasty causes loss of hip stability due to abductor insufficiency. Congenital hip dislocation causes abductor mechanism becomes ineffective. Next question, question number 32. To strengthen hip adductor in supine, the suspension hook is placed option A above hip joint, option B above knee joint, option C medial to hip joint, option D lateral to the hip joint. Here the correct answer is option D, lateral to the hip joint. To strengthen adductors, gravity must create abduction force. Therefore, suspension hook is placed lateral to the hip joint so the patient works against the gravity into the adduction. This is an image you can see. This is the point above the rightly above the hip, but it is nodded just lateral to it. Next question, question number 33. Cause of atonic bladder is option A, injury to sacral plexus, option B, injury to upper thoracic cord, option C, pregnancy, and option D, UTI or urinary tract infection. Atonic bladder or flaccid bladder. occurs due to the injury of sacral plexus, mainly S2, S4, parasympathetic supply, which basically controls the bladder contraction. Due to damage to this, it will lose the contraction of detrusor, which leads to urinary retention and leads to overflow. Incontinence. Injury to the upper thoracic cord basically leads to spastic bladder. Next question. Push. So this is the image. You can see here how bladder contraction controls by the central nervous system or the spinal cord. Next question. Anterior cruciate ligament injury is tested by option A. Latchman's test, option B. Pivot shift test, option C. Anterior drag test, and option D. McMurray test. Here the correct answer is Latchman's test, because Latchman's test is the most sensitive test for ACL injury. McMurray test is used for meniscus injury. Pivot test and anterior drag test both are used for anterior cruciate ligament injury, but they are less sensitive than that of the Latchman's test. Next question, question number 35. Cock-up splint is used in the management of option A. ulnar nerve palsy, option B. brachial plexus palsy, option C. radial nerve palsy, and option D. combined ulnar and median nerve palsy. Here the correct answer is option C. radial nerve palsy. So this is the image of cock-up splint frequently used in clinical setups. Next question, question number 36. The common vertebral level of spondylolisthesis. Option A, L2, L3. Option B, L3, L4. Option C, L4, L5. And option D, L5, S1. Here, the correct answer is L5, S1. Spondylolisthesis is the forward slipping of one vertebra over the another vertebra. The most common level is L5, slipping over the S1 due to high mechanical stress at the lumbosacral junction, and the facet orientation is also involved. So L5, L4, L5 is basically involved in the degenerative type, or in the case of spondylosis. Next question, question number 37. Root of spine of scapula correspond to which level? Option A, T2 level, option 3, option B, T3 level, option C, T5 level, and option D, T7 level. Here the correct answer is option B, T3 level correspond to the root of spine of scapula. This is an image. This is the root of scapula. This is T3 level. superior angle is correspond to T2 level and inferior angle correspond to T7 level. Next question, question number 38. With an abduction deformity of hip on the same side, there will be option A, true lengthening, option B, apparent lengthening, option C, true shortening, and option D, apparent shortening. You should remember one thing, true shortening will be present when there is a shortening of the bone length. So, in abductor deformity, there is no shortening of the bone length. The lengthening, there is uh, basically affected limb moves away from the midline. So, pelvis tilts downward on the affected side. That's why limb appears longer than the actual. So, it is an apparent lengthening. Next, come to question number 39. A 22-year-old boy with spinal cord injury at L4 level, say Asia classification C, will be able to option A, work with HKFO, option B, work with KFO, option C, work with AFO, and option D, will need a wheelchair. Here the correct answer is option B, work with KFO. L4 level basically control of knee extensor. In L4 level injury there is borderline control of knee extensor according to ACL classification, which means motor power is less than 3 in key muscles below the injury. So quads may be weak, so we cannot rely on the quadriceps for knee stabilization. Therefore, KFO to stabilize the knee should be used. Next, come to question number 40. Peroneus longus muscle is supplied by nerve root option A, L2, L3, L4, option B, L3, L4, L5, option C, L4, this is L5 and S1, and option D, L5, S1 and S2. Here the correct answer is option D, L5, S1 and S2. The nerve is superficial peroneal nerve. Tell me in the comment box what is the function of peroneus longus. Next question, question number 41. The presence of anosmia suggests damage to the following cranial nerve. Option A, cranial nerve 2, option B, cranial nerve 1, option C, cranial nerve 3, and option D, cranial nerve 5. First, you should know what is anosmia. Anosmia means the loss of sense of smell. Loss of sense of smell. This occurs when there is damage to the olfactory nerve. Which is cranial nerve 1. Cranial nerve 2 is optic nerve. Cranial nerve 3 is oculomotor nerve. And cranial nerve 5 is trigeminal nerve. Next question, question number 42. Muscle which is not a rotator cuff muscle is This is a very easy question. So I want everyone should answer this question in the comment box. Next question. What are the key principles not relating to CBR? Option A, exclusivity. Option B, equality. Option C, social justice. And option D, integration. So, uh, the correct answer is option A, exclusivity. Community based rehab principle basically includes this one, equality, two, social justice, three, integration, four, participation, five, empowerment, and six, inclusion. These are the main principles of CBR. Next question, question number 44. Following patelectomy, patient can get option A, extension leg, option B, extension deformity, option C, flexion leg, and option D, flexion deformity. Here, the correct answer is option A, extension leg. The patella acts as a pulley to increase the mechanical advantage of the quadriceps. So, uh, after patelectomy, quadriceps efficiency basically decrease and knee extension becomes weak, so it leads to extension leg. Next question, question number 45. The following primitive reflex is present at 8 months. Option A, the palmar grasp. Option B, the symmetric tonic neck reflex. Option C, Moro reflex. And option D, the asymmetrical tonic neck reflex. Here, the correct answer is STNR or symmetrical tonic neck reflex. So, this is the chart. You can see over here that STNR is integrated after 8 to 12 months. ATNR integrates 6 months. You can take a screenshot of this. This is very important for your exam. Next question. Question number 46. A normal 6-month-old infant can option A transfer objects from one hand to other. Option B releases objects. Option C eat finger foods. Option D point with index finger. Here the correct answer is option A, transfer objects from one hand to the another. So at 6 months, infants develops bilateral hand coordination and begin transferring objects between hands. Release objects voluntarily appears around 8 to 9 months. Eating food from finger will take 8 to 10 months, and pointing with index 10 to 12 months. Next question, question number 47. The following part of the brachial plexus has branches that supplies deltoid. So the answers options are option A, anterior cord, option B, posterior cord, option C, medial cord, and option D, lateral cord. I have made a separate video of brachial plexus. You should watch this. You can find it in the playlist. So here the correct answer is option B, posterior cord. Deltoid is supplied by the axillary nerve, and the axillary nerve is a part of posterior cord of brachial plexus. Whose value is C5, C6. Next question, question number 48. The proprioception loss usually develops with disease in option A, anterior column of the spinal cord, option B, anterolateral column of the spinal cord, option C, lateral column of the spinal cord, and option D, posterior column of the spinal cord. Here the correct answer is posterior column of the spinal cord. The posterior or the dorsal column transmits proprioception, fine touch, and the vibration, whereas anterior column mainly involved in motor pathway, anterolateral column transmits pain and temperature, and lateral column is corticospinal motor tract. Next question, question number 49. The ability to stand or walk with eyes closed on sand is indicative of good option A proprioceptors, option B exteroceptors, option C vestibular function, and option D somatosensory receptor. Here the clear answer is option A proprioceptors. This is very easy question. Next come to question number 50. The presence of squint suggests damage to cranial nerve 5, option B cranial nerve 6, option C cranial nerve 7, and option D cranial nerve 8. Here the correct answer is option B cranial nerve 6, which controls the lateral rectus muscle of the eye. So 6 is abducens nerve, supplies the lateral rectus muscle, which basically abducts the eye. Thank you for watching this video. Please do like and subscribe to my channel. If you find the video is helpful to you, share with your friends. Thank you.